Hi, my name is Saif Gallagher. I am a plastic and reconstructive surgeon based in Indianapolis, Indiana, with special interest in gender confirmation surgery. In this video, I'm going to talk about something pretty big. It changed to our practice, and in particular, how and why we're changing our hair removal requirements before bottom surgery for male to female gender confirmation patients who are undergoing vaginoplasty. So, as you guys may know, up until now, we've insisted on a patient either undergoing laser hair removal or electrolysis prior to getting their vaginoplasty. And in fact, I've posted videos on this recently. What we do know is this is very burdensome for patients. So first of all, it's painful, no matter which technique you go for. And number two, it's very expensive and barely or rarely ever paid for by insurance. And also the fact that you have to sit there getting electrolysis or a procedure done on your scrotum for a long time can really add to a patient's gender dysphoria. It probably is the number one thing that holds my patients back from getting their gender confirmation surgery. So this weekend, myself and Nicole went to Harrisburg in Pennsylvania, where we attended the Keystone Conference. And really, a very valuable thing about that conference for me was I was able to go to other surgeons' workshops, most notably Dr. Kathy Rummer, who runs the program at Drexel University in Philadelphia, and who really does so many gender confirming bottom surgeries and really beautiful work. And so one of the very interesting things was she does not require any sort of hair removal before surgery. So first of all, to take a step back, what is the rationale? Why was I trained to require the patients undergo hair removal prior to this? So the reason is I use a penile inversion technique, and I also use scrotal skin to line the deepest part of the new vagina. So the rationale is if you do not undergo hair reduction prior to surgery, you can get hair growth within the new vagina, which is a very difficult problem to treat. So Dr. Rummer, however, in her practice, states that she's simply not seeing a problem with that in the long term for patients. And, you know, so whenever we look at our practice as a surgeon, there are certain things we do because it was just how we were trained. And in fact, probably a lot of what we do is because it was just how we were trained. However, we do know that the better way to practice is to have what we call an evidence-based practice. So you look and see what data is published out there and what the science says about whether or not we need to do something. So in this case, I came home from the conference, and that's what I did. I did a literature review and looked back over and to see what was published on this. So first of all, as in the case of a lot of things in gender confirmation, there's really not that much out there. But what I did find was one very interesting study from 2006 published by Anne Lawrence. And in this study, she surveyed 232 patients who had undergone gender confirmation bottom surgery and asked about the different problems they were having. So only 7% of these patients had significant problems with hair growth in the new vagina. But the really interesting part of that study was over half of those patients who were having the serious problems had undergone a lot of electrolysis before their surgery. So it seems to be that whether or not you undergo hair removal before surgery doesn't really seem to make a difference. And so what do we know? We know that hair removal prior to surgery is expensive, it's painful, and really holds patients back from undergoing their surgeries. But does it make a difference? From what we know, it appears not to. So that is one good reason we're taking into consideration that we're no longer going to require patients to undergo it, because it simply doesn't really look like it makes a difference. Another thing we can look at is, for example, in the experience in cisgender women, and so from a lot of much older publications, we know that in patients who, in cisgender women who didn't develop a vagina, they underwent similar procedures with hair-bearing skin being inverted. And in one study, biopsies were done on these new vaginas down the road and found that follicles weren't present. So again, if it's going to be a problem, it seems that it would only be a short-term problem. And so the great news is, from now on, we are not effective immediately. We are not requiring the patients undergo laser hair removal. We're going to leave the diagram up, and for patients that are worried about this, obviously it's a patient's choice if they still want to undergo it. But as in from now, hair removal for male to female vaginoplasty procedures is optional.